Hello, everyone, and welcome to our new Facebook Live. So today we are very pleased to be at the B&H Hospital in the center city of Bangkok. So we will talk about children and especially children's safety at home. So the main topic will be how to avoid any domestic accident. We are very pleased to interview Dr. Piyachat from B&H Hospital and our Dr. Gerard Lalonde, the medical chief officer. It will be 30 minutes on several topics. It will be what are the common causes, what are the signs, what kind of training we can do for avoiding any kind of domestic accidents, and it will be how to prevent these domestic accidents. So the two speakers, Dr. Piyachat is a pediatric pulmonology specialist, and our Dr. Gerard Lalonde, chief officer, but you already know him. So now I leave the floor to the two doctors, and I wish you a great Facebook Live. I will come back again. Thank you.
Thank you, Alex. Thank you very much for the introduction, and thank you so much, Dr. Piyachat, for welcoming us in this beautiful B&H hospital, which we enjoy so much the presence of the doctors here. Okay, so we'll go through a certain number of questions, which Alex mentioned. But can you first introduce yourself in terms of medical background, what you have been doing as a medical professional?
I'm Dr. Piyachat. I'm a pediatrician. I'm working here for around 10 years, and the specialized is lung doctor and critical care. So I face some people like emergency case, like drowning, cardiac arrest, or foreign body aspiration.
Okay. So that's exactly the type of specialist we needed for this talk, because we are going to talk about mainly accident among children. So before we start about the details of this accident, can you give us some kind of statistics about the accidents among children coming to the ER, or you see in your practice, in OPD practice, or sometimes in the intensive care unit? What type of main accident you feel?
Yeah, in Thailand, we have many emergency cases from like a road traffic accident, injury due to electrical shock, or drowning from the natural body of water, or even though in the bathtub in their home.
Okay.
And most fatal cause is that I mentioned, but the other maybe we are faces about the fall injury or animal bite.
Animal bite.
Yeah, or household product ingestion.
Okay, so I think it's pretty common what we have also in our country, in Europe, because I used also to work in emergency medicine and care, and accident among children, especially traffic accident was very common also. Do you see any difference between the different groups of people living here in Bangkok among the Thai and the foreigner, for instance? Do you see different type of accidents from these different groups?
It's a bit different. Maybe in the family who is a foreigner, maybe they come due to like accident, like accidentally ingestion something, or fall, or stuck by something. Few cases from drowning, but in Thai people, it depends on the age group. If the child can move around, maybe we can face about the injury from like hot water pour on their body, or fall, or sometimes if they can go around and move out of their home, we find the most common is drowning.
Drowning. Yeah. Drowning in swimming pool or in natural water?
Natural water.
Natural water.
Yeah.
I heard, but I don't know if it's true, but Thai people who are not very experienced swimmers, is it still true? Swimmer. Can they swim well? Because I heard in the past that it was not common for Thai people to swim. Is it still the same or not?
I do not have the experience that they have taught to swim in the early year. And I think it's sometimes accidentally, because their parents they do something their housework and they leave the children maybe
a few minutes.
Yeah, something like that.
Okay. So something should be very practical for the people is when a child happens to have faced an accident, he may present some obvious sign or symptoms of, let's say, acute injury or things like this. But sometimes it may not be so obvious. And how people can recognize the first signs and symptoms which should prompt them to seek immediately medical advice.
If they cannot breathe by themselves, or they look like become blue or green color on their face, they cannot breathe normally. You should recognize this is signs of emergency. You have checked on the child if she can respond normally or not. And should be, the parents should have the knowledge of development of their baby, because the accident depends on the child development and on their age. The common accident in each age group is different.
Okay, can you highlight this because it's part of the statistics also? What is a group of age where you see which type of accident, for instance?
Since birth to until 6 months old, even though they sleep in their room, we have to make sure that it is a safe environment for them. Like the crib should be separate from their parents' bed. It should not co-sleep, and the bed should be like a firm surface, and they should not have like a soft stuff to cover their face, and should sleep face up, not semi reclining or face down.
Okay.
And also, if they grow older, they can move a lot. So be careful about they can fall from the height like a chair or on their bed.
This is from 6 months older up to 4 or 5 years old?
4 to 6 months old.
Okay. This would be many falls because they try to go everywhere and go upstairs and then risk of falling.
And we don't encourage to use infant walker because it can cause more accident and more damage to the baby body.
Okay, good.
And when the parents they like taking care of their baby, when the baby cry a lot, they need to calm down the baby. And sometimes they are not recognize or caution that when they calm down, they should hold the baby with support the neck and head. Sometimes they shake the baby, and this can cause to bleeding in their brain because the vessel in the brain was tear.
Okay.
And
you were mentioning domestic product like product to clean the floor or to clean the toilet sometimes. Is that properly stored? And
properly stored, because sometimes the baby can, especially in Thailand, the domestic household product is very colorful.
It's true.
Very attractive for the baby. Sometimes they can reach them and pour it, and sometimes they drink. So it's very, very dangerous. We have to be very cautious to this.
It's also very important also. You mentioned the electrical shock also. That's common also.
Sometimes we have to some baby they can crawl, and they can put the finger to the plug that we do not close it properly. So they have an electrical injury. This is very important thing that parents should have awareness and to close, to secure everything. Even though sometimes they have the like a charging wire around. We have many equipment here. This can wrap around the baby neck too.
And what do you advise if the child got sometimes minor electrical shock? Should you advise the parents to bring the child anyway to the hospital?
At first if they check for response and the baby does not respond, they can start CPR immediately, and they call emergency for help.
Yeah.
In Thailand, we have the number for emergency call 1669.
Okay, that's often a question among expatriates. If there is an emergency at home, where should I go? And what kind of transportation should I use? For instance, we are on Friday, end of the month is about 5:30 in the evening. What should we do if the child has some kind of serious injury, for instance? Should we call an ambulance from the hospital we used to go? Should we call this 1669? Should we bring ourselves? Because we know that the time for the insurance to reach home may be longer than just to go to the hospital. But of course, they don't have the ability of transporting an injured child also. What kind of recommendation, advice you could give? It's not an easy question. There is no easy and standard answer to that. But what kind of...
I think it depends on how emergency of the situation. If you think it's very serious, maybe you start CPR and call for EMS service. If you call 1669, it is a center. They will arrange which the nearest hospital should bring the child in for treatment.
So you advise 1669 is most appropriate?
Yeah.
Okay. Good. What kind of training I heard that in BNH you have a kind of excellence among the child care and also obstetrics, because you have a lot of people coming here to deliver, and also I think you take care very well of your young baby. So do you have a specific training for lay people, for them to learn how to do CPR, for instance, on the children in case something happens?
We also have organized with our emergency department staff to train CPR for lay people.
For lay people
like
also.
Basic life support and also first aid.
Okay. And this is it done by the companies can bring their staff also for training?
I think so. We have staff to provide on-site training.
Even outside training. Okay. So that's interesting. Do you advise companies? We have in our insurance company, we have about 50 to 60 people. Do you advise us to train all of them?
It's okay.
Yeah?
Okay.
So I think we are going to come back to you for this kind of organization. I do believe that making people aware about the condition and giving them the basic knowledge can be useful in some cases like this. Because the first 10 minutes after an acute event
is very critical.
It's very critical, and you don't have the doctor or the emergency team yet at that time. So it's very important that the caretaker or the family, relative, friends could be doing something here. Okay. Can you give us some tips also for maybe many mothers listening to us or people listening to us at home? What kind of, I must say, even common sense attitude or things which you should do at home to prevent as much as possible the domestic accident from young children? Assuming there is a family of 3 children, one just 6 to 8 months old, another one who can be 3 or 4 years old, then another one about maybe 10 years or 12 years old, so different risk among these different kids. What do you advise the parents to make sure the house, the interior of the house is not prone to accidents?
As first, we should know that the different age, the different accidents most likely happen. If the child can move around, you have to keep some item that is very dangerous, not in the area that the baby cannot reach, like a hot item, or anything that they can wrap around their body, like a charging wire, and secure, like close the plug that they can move or touch.
Around the kitchen, especially in the kitchen when there is a fire.
Yeah. And also do not use the toy that is too small, because they can choke on it and can cause a obstruction, complete obstruction their airway. And also the toy that can broken to small piece. And even the pacifier, should they use the large pacifier, and they cannot swallow. And some pacifiers have a hole for breathing, because and do not use the like a pacifier that has a neck strap. Use only the clip on, more safe. And when the child can walk, maybe you should close the door of the house to prevent they go outside, because it can have some dangerous element to them, and need to close the door of the toilet to prevent them to go into and maybe they drown in the toilet due to the bathtub or anything. And should limit the source of water, even though in a bucket or anything that in like even though when they take a bath, should not leave the water high, because the baby can drown during bathing.
And very small amount of water also. So it should not be left unattended during the whole time of the bath. And actually, the parents or the person taking care of the baby should switch off the telephone, because sometimes there can be an emergency call, and then it's emergency just a few minutes, and then it can happen.
That's very, very important, that the parents should have some, should have the knowledge that you have attention to supervision and attend the children all the time, and have the continuous taking care, not leave or do anything else.
Excellent.
And for the child who is older than 1 or 2 years old, they have to teach the child that to know the injury, like from the road traffic too, because sometimes they walk around and they have to caution and teach them to know the dangers from water for prevent drowning. And in the older kids, they also should teach the child to swim if they go like a 5-year-old, and then they need to rescue something in the water. They should not jump into the water. They should put something to let the victim hold on and move the victim, not jump to help.
I think what's very important to keep is from 5 years old up, they should learn how to swim, because there will be, Thailand is blessed by so many seas and rivers, so an accident is even sometimes not really an accident, but you just play around and you fall from the boat, and the basic swimming skills are really needed for kids today. Is it common in school to have a training in swimming?
Not most of the school they do not teach swimming in school. But I think most of the parents quite concerned about this problem, so they bring their child to do the swimming training outside.
Good.
But in some school they also have training to swim.
And for the a bit older kids, sometimes already reaching adolescent years, what would be your advice? So this one will be already going out, sometimes starting to meet friends, coming back late, and they are also prone to some type of accident. What do you advise for?
Use seat belt, and also do not drink alcohol during while riding and driving. But the car seat is also important even in the small kids, because some parents they do not know that they should bring the car seat in when they get a baby back home. We recommend to use the car seat from birth until every age, but the different car seat is different for each age.
Exactly.
If the small kids, they should put the car seat in the back seat.
At the back, always.
And face backward.
That's very important. Very important. Very important point. Okay. Alex, we have a possibility to do some demo. Is what you?
Yeah, of course.
Okay. So we still have some time, I believe. So, Dr. Piyachat, do you think it's possible to show us some basic means to take care of a child who will be very, you can take a baby like this? Because I think
because most of the frequent question from parents I meet at the pediatric clinic, they ask about if the child swallows something small. We advise them to do the foreign body removal.
Exactly.
This is for the kids who is under 1 year old, 12 months. We should, if they recognize that the child happen to swallow something and they cry without sounds, that means complete obstruction. We have to hold the baby by use their hand, and they keep the baby on their arm with the head low, and use the palm of the hand low on the back. 1, 2, 3, 4, 5, and then switch back like this, and use 2 fingers push on the lower half of the sternum. 1, 2, 3, 4, 5. If they see something out, we can remove it. But if we do not see it, do not use blind finger speed, because it's very dangerous. Maybe we can put the foreign body deeper. Do this until the foreign body is coming out. If the child become to lose the conscious, we start CPR by do the chest compression and rescue breathing.
Okay. This is one of the most common requests for your parents, especially at this age.
Especially when they start to give solid food at around 6 months old. Some parents let the baby feed themselves
alone. That's a problem.
And sometimes they don't know which kind of food can harm the baby. So we do not recognize. We do not recommend to give the small piece of food or nuts or corns, because it can easily obstruct.
Exactly. Exactly. Okay. So do you teach the mother in the OPD clinic, or is during the demonstration of when you do CPR training for people?
Both of them. In the clinic, sometimes the parents they ask this question. So I demonstrate this maneuver.
Okay.
Even though they are very knowledgeable, so that's why they ask me to sometimes demonstrate CPR.
Is there any training for the young mother who deliver for the first time during the first days they stay at the hospital after delivery? Do people like you come to train them on these kind of things? Not really.
Not really.
Okay.
Because in the first born mother, many things that they're concerned. Not this point, so maybe I...
You don't want to scare them.
Yeah. At first, I maybe teach them on the other topic, like breastfeeding for baby, how to take care of small baby.
No need to scare them too much from the child small age like this. If we have still some time, can you mention something which is very common? We see that in the insurance also, the allergy problem. Sometimes the allergy are very minor, it's just a bit on the skin, but sometimes it can take some serious dimension up to the anaphylactic shock. So what is your recommendation for the, again, for the parents when they see a child having some kind of plaque on their skin and then sometimes becoming itchy, up to sometimes some difficulty to breathe? What do you suggest for this case?
At first, if they already know that the child has the history of allergic to something, they have to avoid them first, and have to to have some simple medicine at home, like antihistamine, and the label that the child has the history of allergic to some kind of food or drug. Even though in some cases they also have experience of anaphylactic shock, the doctor usually prescribe EpiPen for standby.
So EpiPen will be already for those who have kind of serious allergic condition can lead to this. But sometimes they may know the child is allergic, but it will be an accident, for instance. They go to a kind of a party and there is some food which is not good for this child, but it doesn't know. And just by chance, he takes some food over there, the parents did not notice, and then he comes back with a lot of plaque. So what do you advise if it's not a serious allergic type, but still with some kind of concern from the parents? You suggest them to bring to the hospital quickly?
Bring to the hospital if the serious reaction, cannot breathe or cannot breathe and become blue.
That's very important. We have also in our insurance some people who get allergy and then they finally finish in the intensive care unit also, because it can take a serious proportion and very quickly also. Okay. I think we have reviewed most of the topics here. This will be maybe for the adults, not really appropriate. You want to demonstrate?
We can finish like this,
we can finish like this. So before I give you the floor, Alex, I would like to personally thank you for this lively discussion. So really enjoy it. And I hope we will see you again, because definitely we'll bring our team. I very much believe in awareness and knowledge for these kind of things, because as we discussed, the first 10 minutes, there is no assistance, there is no medical staff around. So it's left to the caretaker, to the relative families. If they don't have the basic knowledge, sometimes it can really change dramatically the prognosis of the case. So again, thank you so much for this.
Thank you very much. Thank you very much.
Alex?
Okay, we are here, right? So, it's okay for the mic also. So we would like to thank you, especially Dr. Piyachat, for all the tips, and also B&H Hospital and all their teams for welcoming us here. I hope all this subject was very interesting for you and for mom and also family, because all these kind of things can happen every day at every minute. So we would like to thank you, and we also would like to say that we have a privilege from B&H Hospitals. You can do a checkups, medical checkups. They have special price for our Luma members. So it's pretty important, and it's really, really useful for all of us to check up for every kind of things. At least one time per year, we recommend. So we would like to thank you. Thanks to our famous Dr. Gérard. Thank you for Dr. Piyachat for all your tips. And thank you to all of you who are watching this Facebook Live. We wish you a great day, and we see you soon for another subject. Thank you so much. Bye-bye.